Are my volunteers sleeping? No, they're not sleeping. They're sitting there with heat on. So all three of my volunteers have different types of heat on. They have infrared light, then you see there's a moist heat pack on the back, and on the far table we see there's a paraffin wax. So all these are types of heat and ways that we administer heat down in physical therapy. So heat modalities can be used to increase metabolism, increases the metabolic rate, and it helps increase the vasodilation in the blood vessels, so it can help with healing. And like I said, these are all different types of heat. Reasons why we should do that could be a subacute inflammation, it could be chronic inflammation, soft tissue tightness, pain management. Reasons that we wouldn't use heat on somebody could be because it's an acute inflammation, so it's hot to the touch, or they have an impaired sensation, over malignancies, skin infections, circulatory insufficiency, or if they're, very young or very old, or someone that we think has increased sensitivity. But reasons we could use it are for muscle sprains and spasms or arthritis. We usually keep the treatment on for about 20 to 30 minutes. And here we also have the hydroculator, as you see in the corner, and we have those towels and the heat packs on, because anytime we use the moist heat from the hydroculator, and that water is between 165 and 175 degrees, so it's pretty hot, we want to protect the patient. So we're going to use all those towels and those pads up there to protect the patient. OSHA is going to rule 6 to 7 layers, and so as you see in our heat pack on the back, we've put on some layers. And she's going to lay there, like I said, for about 20 minutes or so with the heat on, and it's going to feel really nice for her. After we use any type of these heating modalities on the patient, when we take it off, we're going to inspect the skin, because we want to make sure that the skin is intact and that there's no blistering or redness afterwards, because that would obviously not be good for the patient, and we need to indicate that because they may need more or less. Now, for the hot pack, it can only penetrate about 1 centimeter below the skin, so it's better for the more superficial tissue. It's not going to go that deep in there. But as for the paraffin wax and the hot pack in general, those are both forms of moist heat, and we like the moist heat better than dry heat because it gets into the tissue layer a little bit better. Like I said, about 1 centimeter deep, versus if it's a dry heat pack, which just kind of takes moisture from the skin and takes moisture from the area, so it also just heats up the skin more instead of the tissue, so we don't like to use it quite as much. The moist heat's a little better treatment for us.